If you have a tremor and you're serving a hot coffee to someone, they get a bit nervous, you know, and I understand that. Every little routine movement became difficult. And a lot of people don't really realize that.
Sometimes I'd find knives and forks laid in a little table setting on the floor somewhere, or, you know, with gas on, or, you know, it was scary and very difficult, very humiliating. We got stopped from going into a taxi in London because they said, yeah, I'll take you, but I'm not taking him because he's drunk.
The biggest single problem was my right arm tremor, which was killing me. I had no control over it, and now I have control. The procedure went very smoothly and everything went well.
It was miraculous. He was like a young man again. Here's the scar where they put the implant, the Vercise, in, and here is the actual Vercise little implant. You can almost make out. It's like a little compact makeup thing. It's fantastic.
So I don't have to replace it for 25 years. I hope to show you now how effective this Vercise equipment is. I'm going to turn the remote, with my remote, I'm going to turn the stimulation off completely. So I'm doing it right now. We should start to see some increase in the tremor, which is starting now already. I'll show you my hand, because before it was fairly steady. And then it will increase to quite a bad tremor in the end. And I'll increasingly be moving around because that's what the effect of the drugs are, really. And I will be increasingly more uncomfortable and difficult. I find difficulty in talking. I don't know how long this has been, but I think in a moment I'm going to have to turn it back on. And I'll do that now. Stimulation is now coming back. Yeah. And the effect is almost immediate. You see, I get this kind of warm feeling comes through, and it's amazing how that works, actually.
Let's talk about the recharging thing, because the recharging thing is very, very easy. As you can see, he's got his doohickey on. This has got the weight in it, the counterweight, I believe. And this side has already got the battery recharger on. He's already got it on. Normally what he does is he sits in our recliner at home in front of the TV, and he'll sit there for maybe, a couple hours?
Yeah.
And it will charge up while he's doing it. As you can see, it's real easy. It just stays over the pack. You can feel the battery pack in his skin underneath, the Vercise, the doohickey underneath. And then it sits on there. And if he does, because occasionally he'll sit there and he'll drink tea and coffee, and that's what he'll do. He'll drink tea and coffee, and as he's reaching for his cake, he'll move it, and it'll peep. So he'll just put it back on the area, and there he is. It's simple, brilliant idea, brilliant invention. Look at that, fantastic, a real knuckle duster. So I mean, it's a brilliant idea. This collar works very, very well. He recharges normally about once every 2 weeks. Or 10 days, let's say, and it takes him about 2 hours. Occasionally, if he knows we're going to go somewhere, he'll just charge up a bit more, and it's just very simple. He does find, as I say, it peeps when it's out of the way, so that's okay, that's fine. He'll just move it back on, and providing he's in the right place, it's just a few minutes. Sometimes he'll just do it for. So it's very simple, isn't it? Yeah.
The difference it's made to my life and the quality of my life to have this Vercise equipment active and operating within me is just remarkable.
They've got their dad back, and I've got my husband back, and it's because of Boston Scientific and their Vercise, and every single little component, every single little idea. The togetherness is profound, and we are just so grateful. Just God bless you.